Do you guys remember when the internet first started, when we had those dial-in things? And you know, I said to myself, I am never going to use the internet. Guess what? I'm using the internet. And how to use the internet better? Ask some young people. So we got Sonia, Stephanie, Stuart. They're gonna tell us how to use the internet better. Fire away, guys.
Yeah, thanks for the introduction, Dr. Curnew. So exactly like Dr. Curnew said, today we're going to be talking a lot about how to harness the power of the internet. So the internet is very big, very confusing, very overwhelming at times, but there's also so many benefits to it. And hopefully today we'll chat a bit about how we can use that technology for the benefit of our health. So on to the next slide, we'll be talking about a few things today. We'll start off by discussing how to navigate YouTube, and then particularly we'll show you how to go about navigating our YouTube channel where we have tons of info there. We'll touch on how to create an email address, also chat a little bit about social media, specifically Facebook, and then we'll end off today's chat thinking a little bit about medication reminders and how to track blood pressure. So a question that I always get from a lot of patients is, well, what role does technology actually play in our health? And the link between technology and health sometimes isn't as obvious as people may think. But technology has actually been shown to have a lot of different benefits for our health. And the first one has been that it's been a tool for social bonding. So this was really, really evident, especially in the last 2 years or so that we've lived in this crazy world, the crazy COVID pandemic era, where we've had to connect with a lot of people virtually, whether it's through Zoom like we are now, whether it's through social media. So a lot has changed in the last few years. And one thing that was really evident was how we use those technology and those different resources to basically maintain our friendships, stay in touch, and see our loved ones. So it can really be a powerful tool to keep those connections. And then in turn, it is associated with lower loneliness and depression, and just an overall enhancement of our social networks and life satisfaction. And the second benefit of technology is it can be used to directly facilitate a lot of our healthcare goals. So we all have goals for ourselves, whether it's to lose weight, to have a better diet, to get more exercise, but those goals sometimes just stay as goals, and it's hard to get ourselves motivated to start on them or to keep track of our progress. And this is where technology comes in, because we're able to see the progress we're making towards our goals through things like phone applications, but also stay informed on how we're doing overall, whether it's through accessing our blood work or reading our health reports online. So it's a really good way to stay involved and take charge of your own health. And I'll pass it on to Stephanie, who'll chat a little bit about the new website.
Okay, yeah, so Dr. Curnew Health has a new website. The domain name is here. So all you got to do is search up drcurnewhealth.com and it'll take you to our new website. And we're just going to go through it so that everyone can see what exactly is on the website.
So we used to have we used to have something called drcurnew.com. What happened there? Well, let me tell you a story. So we got hacked. We got attacked by viruses. We used all sorts of things. We couldn't get it. It's gone. So sometimes it works, sometimes it doesn't work. And so if you don't succeed, try again. So we have a new and improved. So I should be quiet. Go ahead, tell us about the website, guys.
Yeah, no worries. Okay, so yeah, just like I said, all you gotta do is search up drcurnewhealth.com and it'll take you to our new site. We're pretty excited about it. It just recently launched like last week. And here it's basically like a hub or a center for everything that we're putting out for our patients and for you guys. So this is just our homepage, and you can kind of see like a little bit about the clinic and just a little snippet about everything we offer. So through here, you can access like our YouTube page and our content there. You can look at what support groups our clinic currently offers.
Wait a second. How do you get the homepage? How does that work?
Yep. So inside there's drcurnewhealth.com. So all you gotta do, search up Dr. Curnew Health. Oops. That's just my laptop issue. All right, yeah, all you gotta do is search up drcurnewhealth.com, click enter, and then you'll be taken directly to the homepage. Yeah, okay. And yeah, like I said, you can just scroll through and see everything that we have to offer. We've also got some things about the clinic itself. Here you can also sign up for weekly updates. You can look at our social media channels. You can check out our contact information, where our clinic's located, Instagram, YouTube, Twitter. And then if you're usually at the homepage or at the top of the screen, you can see all the different pages that we have on our site right now. So for example, we've got our YouTube page, which is basically going over our YouTube series, all the different topics that we cover, when it is, if you want to sign up for notifications for the YouTube videos and webinars that we post, just some information on how to access the YouTube page.
So we should encourage everybody to sign up to that. So you need an email address, and then we will notify you about once a week or so. Is that the way it goes?
Yeah, exactly.
Okay. So you put your name, your last name, and email. Does it have to have a Google account, or it can be any email address?
It can be any email address. Yeah.
Fantastic.
So yeah.
And those are the videos. Okay, fair enough.
Yeah, and at the bottom, you can also share what you want to see. So if there are any specific topics that you want us to cover in the YouTube videos on the YouTube page, just like, again, leave your name, last name, email, and what you want to see, and send it to us, and we will respond promptly. Other than that, there's also our focus groups. So as you know, we offer a variety of focus groups with like different goals. So you can kind of scroll through all the different ones here. You can also sign up for them. If you want to learn more about them, they're literally all on this page, and that way you don't have to say call the clinic or ask Dr. Curnew himself. It's all here. You can just click sign up, and it'll take you to our sign up page. Again, same thing, name, email, phone number, what club you want to join, and sign up. It'll send us an email, and we'll be informed, and we'll just put your name down for the next meeting. Yeah, and then you can also see about us if you're interested in that, about Dr. Curnew himself. You can look at our appointments page, so like what to expect for your appointments. We get a lot of questions, like common questions and FAQs that patients ask about the appointments. And so, you know, if you do have questions, maybe check out the site first. It's like easier for you to be reminded and remind yourself of what to check before coming to appointments, for example. We also have a list of like what kind of tests we do at the clinic and more of what we offer. We also have just some information for common medications. So, you know, if you're ever interested and want more information but can't access us right away, again, you can come here. And then, yeah, finally, you can just contact us really, like, about anything. Like if there's something that you want to see, if there's something on the site that's not working, if you want to see something on the site, literally anything, just shoot us an email and we'll be informed of it. And this is maybe like the easiest way how. So yeah, and then also just our contact information's there if you just can't happen to find it or you just want to be reminded. Yeah, it's all there. And that's the site. Again, it is drcurnewhealth.com. So yeah, please check it out.
I want to thank Stephanie, who take a real lead in this, and Stuart and Sonia. Sonia actually developed our previous website. She does a really good website, but it got infected with viruses and things of that nature. So, and the thing about the internet is that, you know, getting good information versus bad information. We hope we'll give you reliable, good information that you find helpful. And it's the work of a few hundred people. These young people have taught me so much. in so many ways. And if it wasn't for them, we couldn't do them. So a really appreciation to the hours and hours of work these people have put into this for your help. So I hope you take advantage of this and really learn, because I am very curious. I've been learning for 50 years, and whatever I have, would like to share with you. And please take advantage. We're trying to do different ways of doing that, from our book to our webinars to this website. So very proud of what these young people have put together. It's not an easy task. They always make it look so easy. So thank you so much, and share ideas too as well. So for instance, we're going to get a bulletin board, so something you can actually, if you say, listen, I want you to look at this, and we can try to look through that and decide whether we want to post that or not, and maybe do some research on that area. And so this is neat, and thank you so much, Stephanie. And Stephanie spent a lot of time on this. Sonia spent a lot of time, and Stuart, and so many others as well. And thank you. Take advantage of it. What's next? So we're going to go back to the presentation today.
Yeah, is everyone able to see the screen? Perfect. Yep. So right now we're just going to be also introducing the app that Dr. Curnew and his team have been working on. As Dr. Curnew mentioned, we're working on another resource that can help you stay informed and updated on your health, which includes reminders on appointments, how to keep on track with your medications, and also some helpful resources to learn more about what's available on the internet or other things you can check out about your health. So Stephanie's briefly going to discuss Dr. Curnew's clinic app, which he's currently working on with his team as well.
Yeah, I think Stephanie's just rejoining the call because she had some tech issues. Stuart, if you wanted to maybe start it off.
One of the things I'm going to say is that I hear too many times people saying is that the pharmacist will call you up when we run out of medications, and that's bad health. I don't want a phone call from the pharmacist. I want to call with you to make sure that we have a direct communication, so we're on the same page, that the medications that you're prescribed are the patient medications that you need. So this business, nothing has changed. Things change all the time. You change. New medications are maybe better or worse, and things of that nature. I'm always struck is that you don't wait till you're out of gas before you call the tow truck. And but when it comes to medications, that's what most people do. And by doing that, you put a delay in people's health. Today, for instance, is that I had to have a choice. Do I renew your medications, or do I take care of a patient that needs to go to a hospital and have surgery tomorrow morning? So there's only so many hours in a day. I want to make sure in the right time, but I don't need to spend 2 hours every day with my team figuring out your medications. You need to become important or part of that. 50% of people change or stop their medications, often without good advice on the matter. So, and this app will hopefully be a central place for your hub of medications that you can share with your entourage, maybe your spouse, your friend, your next door neighbor, your pharmacist. But you need to think about, are you on the right medications at the right time? And you're going to have those available to you. Pharmacists are allowed to renew medications, but they can charge you. And maybe that's the best thing. I don't know, but I want you really to be very actively and properly involved in your medications and understand them, because they're so important. I can actually lower your risk of having a stroke in atrial fibrillation by 70%. I can lower your risk of having a heart attack, high dose statin ezetimibe by 60%. By the burn of blood pressure, you should know your blood pressure, and we should work to get on that. So and what about good lifestyle changes? How to make them work? Let's figure this out. So go ahead, guys. Thank you.
Yeah, Stephanie, did you have anything else to say about the app before we move on?
Yeah, if I could just share my screen.
That's what I always like about technology, sharing screens, finding things and getting them to work and things of that nature. And in fact, today, actually, we lost our internet again. We had a power failure and thank you, it's short-lived. Having backup systems are always important.
Stephanie, I'll try and help you when it comes to sharing screen. It might be difficult now though, I think, but let me just try something. All right, let me see if that helps in any way.
So a lot of we've done a lot of things on the internet at this point in time. Oh, let's go ahead. Let's tell us about the app.
Yeah. So I believe the app is currently launched on Android. So you can download it if you want, and we're providing a link for that. This is not what the app looks like right now, but this is kind of a run through of what the app is, what we want it to look like in the end, and all of the features that it's going to have. So it's like good to have it right now, and then as we roll out with updates, obviously it'll get better and better. So it's basically just like you sign up, and then we'll basically have a hub for like learning and all of the webinars and like YouTube videos that we put out, all of the articles that Dr. Curnew recommends, all of the YouTube channels he recommends, all of the apps he recommends, organizations he wants you to look at, all of our socials will be here as well. So there's that, and then you can also like search for content, stuff like that. The app, we also wanted to have like an appointments page, so we're hoping that you can maybe track your appointments, maybe even create new appointments, like book them directly through the app, like so. We also want to have a medications page where you can track your medications, and that way it's easier for Dr. Curnew to also know your medications without you like bringing in like 5 different medications lists plus your medications plus, I don't know, your prescriptions, right? So that way it'll be easier for everybody to keep track of exactly what you're taking, including yourself. You can add like pictures, whether it's active, when it was prescribed to you, who prescribed it to you. You can look at the history of your medications. You can edit the information. You can look at discontinued medications, add new ones, whatever. And then you can also, the app will give you like reminders like, hey, we have a webinar out right now, so check that out. Hey, you have an appointment coming up, check that out. Have you updated your medications recently? Do you have any questions? Because another feature of the app is that, again, we really care about your input as a user and as a patient of ours. So another feature is just like, if you have questions, just send them over and we're gonna see them. And we're gonna answer you, like whether that's through our webinars or through the app or through an email, whatever. And then again, there's like an FAQ section, just like the website, where you can just like look for information pretty easily. And yeah, so that's kind of what the app is going to look like. Again, it's out right now, so download that. Yeah, that's about it. And I believe Dr. Curnew also wanted to talk about Dr. Mike Evans' YouTube channel.
For instance, I met Dr. Evans many years ago, and he struck me as being really a very smart guy, and he actually simplified a lot of concept. And he's one of the first people that uses this Blackboard concept, and he brought this to a higher level. And so this is a YouTube channel that everybody should take a look about. He has many topics from smoking, healthy eating, to exercise, and he summarizes things so elegantly. And so we'll put links to that for that page, for instance. We all have our favorites, and that's something that he's a wonderful man, wonderful group of people behind him, and something you should look at. So that's one example. So we'll make that easy. So we'll suggest that for you. Take it away. Yeah, go ahead.
Perfect. So I'm just going to go back to screen sharing, and I'll pass it over to Sanya.
Yeah, that's perfect. So definitely a lot of exciting updates in the clinic in terms of the website and the app. So please do check those out. And then this is a great segue into sort of discussing a bit about the next section, which is learning how to navigate YouTube and thinking about all the resources we already have out there. So when are the videos released? So as you may know, on Wednesdays, we have shorter videos that are released. They are all sent out through the clinic newsletter. And if you are not already subscribed, you will be able to do that through the website as well, or you can always let one of us know in person or over the phone, and we can enter your email in too. So those videos are normally about 8 to 10 minutes. They cover a variety of different topics, which we'll get into in just a sec. And then on Fridays, we have webinars that happen every week in the evenings, and then they're also recorded and posted afterwards on our YouTube channel. So if you're unable to make it live, you can always go back and refer to them afterwards.
And we can decide over time if Friday is the right time for most people and stuff. So, you know, we initially picked Friday because during the pandemic, people had nothing to do. And so we thought that would be a good thing to do. Now, Friday nights, there's lots to do. So we can decide if that's still the right time and place. So, you know, we're going to actually send you forms, something called from Ocean, or you put your opinions on. Just let us know when is the best time for you to learn. I know is that all these videos I've seen more than probably a couple times, and you know, we forget 80% of what we learn. You have to keep looking, fast forward, rewind, do sorts of things. So I encourage you to look at them, repeat them, certain parts of them, keep learning, and certainly use good sources, but reputable sources.
Mm-hmm. Yeah, great reminders, Dr. Curnew. And if you may have known, we've done this for a while. We've had videos and newsletters and webinars up for a while, but we've also been making a lot of changes to it as we go on. And we're always looking for ways to improve to make sure that it's as helpful to you as possible. So recently we've upped our videos. For the past few months, they've been with enhanced animations. We've covered a lot of different concepts, all directly coming from questions that you have when you come into the clinic. And they're shorter now to help you digest information. So yeah, we're always changing, always improving. And if you have any feedback, we'd love to hear more about it and make more changes too. So in turning to how you actually access our YouTube channel, basically you would go onto Google and go on to www.youtube.com. And in the home page at the top, you'll see a search bar as so. And in the search bar, you can go ahead and type in Greg Curnew, and you'll see this lovely photo of Dr. Curnew that pops up. And you can feel free to click on the name and the icon. And once you do that, you will see on the next slide here that our YouTube channel will pop up. So this is the home page of the channel. So there's a couple of different tabs. There's a home, videos, playlists, etc. And if you click on the videos tab, you'll be able to see all of our uploaded videos from the most recent to the least recent. So you can see some examples here. The ones that are recorded webinars will say webinar in the title. And then otherwise, there will be shorter 7 to 10 minute videos that are usually released on Wednesdays that you can also take a look at. You're also able to watch via the playlist button at the top. So we've put a lot of effort and time into organizing our videos by topic. So we have different groups like the mindfulness group, exercise club, etc., that are making videos relevant to their focus. So if you're really interested, you can also search it up by playlist. So in the next slide, I'll just show an example. For example, if you're really interested in learning more about cholesterol and how to improve that, you can use the search bar as well and type it in, and all the relevant videos and webinars will come up. And then the next slide shows a similar
If you go back a little bit, if you go back over here, so you can, if you look under cholesterol, you can see that there's a 7-minute video on statins, gives you the highlights. Then there's a long one called the statin debate. So if you ever had soreness on statin therapy, you need to look at this video. And then if you, so these are some starting points. You need to digest that and decide, what do I do next? And you know, you don't have to rely on just this source, but this is the one that I've been thinking about cholesterol for 50 years. So, and I will try to give you that information. I will say this is that I alternate between Crestor or rosuvastatin 40 milligrams a day, or atorvastatin 80 milligrams a day, and 10 milligrams of ezetimibe. And I plan to stop these medications the day after I die, because that will lower my risk of heart disease by 60% if I take it for 5 years and longer for longer durations. What we learned about cholesterol is it's the burden of cholesterol over a lifetime. And so lower, longer is better. So if you're going to wait to have your heart attack before you treat, that's certainly one strategy. I'm trying to prevent my heart attack. I've never had a heart attack, and hopefully I can delay that for a long time. The average males has somewhere between a 50 to 80% lifetime risk. Similar females can be close to that depending on their risk factor profile as well. Only difference between males or females is that females develop heart disease 10 years later compared to males. So there's so much you can do to prevent, and these are ways that work extremely well.
Absolutely.
High blood pressure. Yeah, tell me about blood pressure. So blood pressure is another one. Sorry about this, but it's also the burden of blood pressure over a lifetime. The mistake that many physicians, including myself, made is that we're saying young people don't have stroke or heart disease. We're going to wait till you get older before you treat your blood pressure. But it's a burden of blood pressure over a lifetime. And so if you have high blood pressure and you're in your 20s or 30s, that means your vessels are already diseased. And so don't ignore this problem. And God damn it, measure your blood pressure. Keep track of it over time. I shouldn't use that word, but it makes no sense to me not to measure it and find ways of doing that. Go ahead, tell us more.
Yeah, absolutely. So this is just another example. If you're interested in learning more about blood pressure, how to manage it better, or even to track it, you can type in hypertension and you'll see all the relevant videos there as well. So, and the next slide just shows a similar thing, but with diabetes. So as you can see, we've covered a lot of different topics in our videos. There are shorter videos, longer videos. You can pause, play, rewind. So we really recommend that you take a look and spend some time just exploring our website and watching whatever interests you the most and whatever is most helpful for you. And of course, we're not the only channel that has information out there. We just talked about Doc Mike Evans, so they are more cartoon animated. We also recommend checking that channel out as well. It would be a similar process using the search bar for other videos you might enjoy. So with that, we'll move on to our next topic, which is creating an email account. So why is an email account important? Well, to access a lot of things online, you usually require an email address to sign up for different accounts. So for example, in some of our past YouTube videos, we've covered how to access your lab results online, both through Life Labs as well as through DynaCare. And to log into those websites and see your blood work, you actually need an email address when you make an account. So, it's really important for you to have an email address for that, and also just to stay in touch with your friends, your family, your loved ones is another great way, or even for things like signing up for a newsletter and getting that email directly to you as well. So lots of benefits, and hopefully this will help you sign up. So the one we'll be going over today is Gmail. So to make a Gmail account, you would go on to this website here. So www.gmail.com. It will show you a sign-in page similar to this. And if you don't already have an account, you can click at the bottom, create an account. And from that point on, you can enter in some of your basic information. So things like your name, what you would like your username to be, which is essentially the email address you would give to other people or use to log in. And you can also create a password as well, and just make sure that you take note of your password, or it's something that you know you'll remember. And you can click the next button. From there on, Google might ask you to verify your phone number, and essentially you would enter your phone number in, and they'll text you a 6-digit verification code. And on the next slide, you'll see that you enter the verification code in. And this is just an extra security step Google does to make sure that you're actually you creating that account. So it's a pretty easy process that way. You can go ahead and click verify. And then on the next page, it'll ask you a few more questions, most likely ask you for a recovery email address. If you have another one, you can enter that in. And it'll also ask you for things like your birthday and your gender as well for your account. And the final step is to read through the privacy and terms for Google. And if you agree, feel free to click I agree. And that is that, your account will be made. So it's a pretty simple process to sign up. It doesn't take very long. But of course, it's, can be more difficult to sometimes navigate the email itself. But if you check out on our YouTube channel, we have a whole video going through how to compose an email, how to send, receive, etc. And if you ever need any help with this process, you can feel free to reach out to any of us and we'd be happy to walk you through that in more detail. And I also wanted to highlight that there are other email services that you can use, whether it's Outlook or Yahoo, and tons more. So feel free to explore those options and see which one works for you. And another common question we also get is, I made an email a while ago, or I think I have one, but I don't remember the password. And that's pretty common. It happens to all of us. But if you don't remember the password of your email, you'll notice when you sign in, there's also an option to click Forgot My Password. And Google will guide you through that process and essentially email you a temporary password that you can use until you go in and reset your old one. So again, if you have troubles with this, feel free to reach out to us and we can help. But just know that the solution there does exist for that as well. So that's how to set up an email account. And then another thing I thought would be helpful to go through is also how to use Zoom. And you'll notice again, like we are right now, for those of us joining the Zoom call directly, it's a great way to chat again with your friends or family, or if you're joining in our webinars, whenever we have discussions or if you have questions, you're also able to ask us directly online. So essentially, to join Zoom, you would go on to this website here, so zoom.us. Usually it's a clickable link. And it'll take you to the home page of the site. And in the home page, you'll see a few buttons at the top right corner, specifically one that says join meeting. So if you've already been given a meeting ID or a meeting's already been set up for you, you can go ahead and click that. And once you do, you can enter in your meeting ID. So for our webinar specifically, we usually have a direct link to the Zoom in the newsletter itself, but we also always provide the meeting ID. So it's a few digits of a number that you can enter in here and click join. And you'll see, again, this is an example of someone, if they were to send you a direct link, you could just click that link directly and it'll let you enter in the meeting. And the meeting ID is also there as well, just as a sample for you to see. So once you enter in the meeting ID and click join, you'll have a little pop-up box like this, just confirming that you want to open up Zoom on the app or on the browser. And you can click go ahead and open Zoom. And as soon as you do, the first thing Zoom will ask you is how to connect to your audio, essentially. So feel free to go ahead and click join with computer audio if you're on your laptop or a computer, or if you're calling in, you could just switch the toggle to a phone call and it'll let you enter in without a camera and just through your phone. But usually I click join with computer audio here. And when you click that, you'll basically be in the meeting. And in the meeting, you'll notice that there are a few different buttons and panels on the bottom of the Zoom screen. So we'll just go over a few of them now. So on the very bottom left, you'll see a mute or unmute button. So essentially, when there's a line across the microphone, that means that you are muted, so people are not able to hear you. And then whenever you want to speak, you can always unmute yourself and feel free to chime in. You can also have the option to start or stop your video. So we'd love to see your faces in our Zoom call, but if you're busy or doing something else and don't want to, you can also stop the camera. There's also other options as well. For example, if you click the participants button, you'll be able to see everybody else in the Zoom call. If you click the chat button, you'll be able to also type in any questions you have, any comments you have, which some folks have already been doing today in our meeting. So that's always nice to see. And also if you're joining, for professional things or you're joining to present something, you can always click share screen, which we're doing now, and you'll be able to show everyone your screen that way. So lots of different options. The last one I'll go over is end meeting, which is usually at the bottom right-hand corner. So whenever you're done with your Zoom call, you can click that red button and you'll be able to leave the meeting. So usually in a Zoom, you'll have everyone's icons at the top. As you can see here, you'll be able to see everyone's faces and then also yours as well.
So Sonia, let's say I wanted to share something with somebody. So I have to go to the shared screen, is that right?
Exactly. So there's a green button at the bottom that says share screen. So once you click that, it'll ask you sort of what tab you want to share, and you'll be able to show everybody what's on your screen, which is pretty neat because it lets you do a lot of neat things when you're wanting to share.
Also too, there's this record button at so we record all our meetings, and and you have to be comfortable that you're going to be recorded. So if you go to a Zoom meeting, if you don't want to be part of the meeting, you can always not participate in the meeting. So this is how things are going. And I always find sharing your face and things of that nature really shows a lot. So you have to decide if you feel, I look like a mess, like I always look every day. I didn't shave this morning or whatever. I just, as long as I have clean underwear and clean socks, I'm good. So it's kind of nice to share. But if you feel comfortable, you don't want, you don't have to. And which is wonderful. You have all sorts of different things. And then obviously is that if you're not talking, you should mute yourself. So it makes it easier for you won't get extra sounds and things. And I think it's just a fantastic technology. And that's great. Now there's different versions of Zoom. I think there's some that are free. There are meetings that I think those are less than an hour, I think, and there's a certain maximum. There's some that is secure ones for medical things that you can get to as well, or universities, other programs. We're using one from that gives us longer duration of meantime. Maybe we need a shorter one, so we always go overtime, and that's my fault all the time. But I think thank you for sharing all that with us.
Yeah, of course. And then we also have some webinar reminders here as well. So again, if you can mute yourselves when you're not talking, but of course, if you have something to say, feel free to unmute. Also the start and stop video, and also the chat function, as I mentioned before. We'd love to hear your thoughts. If you have any questions or comments, feel free to chime in through chat as well. And the next slide, it'll just show you an example of our newsletters. So again, we'll usually give a little image that has the topic of the night. We'll have a little description for you to know a bit more about it. And then right underneath, there'll be an option to join by Zoom. So again, just click where it says click here. It'll take you directly to the Zoom meeting, or there's a meeting ID if you need. And then of course, we also live stream on YouTube. So you are more than welcome to join there as well. So lots of options for you to stay in touch with us. So the next thing we'll go over is how to use social media, specifically Facebook. And I think we'll start off with just a quick refresher on how to create an account. So Facebook, again, a very famous, well-known website that's used to chat with friends, family around the world. And it's very instant as well. So it's always nice to have that connection. But you essentially go on to facebook.com and you can click this green button that says create a new account. From that point on, you would enter in your information. So you can see it's very similar to if you were creating an email address, for example, your name, your number, your password, as well as your birthday. And once you've done that, you can click sign up. After that, Facebook will send you an email to your email account just to confirm that it's you. So again, if you don't have an email, this is where an email account becomes very handy to have, but it's just a verification, and you would go in and click that, that verifying email, and then you'd be able to get your account started. So a very simple process, only takes a few minutes. And again, we have a video going through all the different features of Facebook on our YouTube channel as well. But one thing I wanted to highlight here in the next slide is our Clinic Life group on Facebook. So We essentially post a lot of the webinar links and topics on this group as well, just so that you're able to have direct access to them. For example, if you check Facebook more than your email, you can also take a look there. So to search it up in the Facebook tab, you can just go into the search bar and type in Greg Curnew Life Group. And essentially you can like the page. And when you like this page, you'll be able to see updates on the feed directly. And every time we have a webinar, we'll usually post it there too. So the next slide just shows a few examples of some of the posts we've made in the past. And you're more than welcome to like the post or comment your thoughts on it. Or even if you click the share button, you can send it to other family or friends that may want to join as well. So a great way to get everyone involved. And we have a lot of focus groups as well on Facebook that we've now started. And I think we're going to touch on a few of them at the end of the webinar too. But one of the ones that's been really well engaged with is the weight loss group, for example, on Facebook. So that's a really great way for you to also find other individuals in the clinic who are working towards the same goals as you and kind of share resources on that group. And support each other in your health goals. And it's always nice to find a little community online. So you can feel free to check out our Facebook groups as well. So the next page just shows the example of the weight loss group. Back when the screenshot was taken, there were 75 members, probably more now as well. So lots of announcements, and it's great to see people will post photos of like their meals, for example, or new milestones they've reached. So it's always heartwarming to see everyone make that progress together. And I'll pass it on to Stuart for some final topics.
Thank you so much, Sanya. So now I'd like to just discuss something which is really important, and that's medication reminders. As we know, keeping track of your medications is incredibly important if you want to stay on top of your health goals, but sometimes many patients might find it difficult to understand what medications are for, when they need to be taken, and also just keeping on track with it on a day-to-day basis. And so we wanted to provide some information on how to sort of stay on top of this particular goal. So first, it's important to discuss what a medication area is in order to understand how significant or important medication reminders are. Each year, we know that there are at least 70 or 7,000 preventable deaths which occur in America due to medication errors. Medication errors can be an overuse of medications, forgetting to take medications, or really just using prescribed medications inappropriately based on how they're prescribed. And so it's really important to stay on top of these medications so that you yourself or someone you know doesn't become an unfortunate medical error. Now, there are many different causes of medication errors. It can be related to miscommunication. Of course, there are many similar medications which cannot either look the same, have similar names, or have doses which are quite similar, which can lead to some confusion as to what should be taken and how often it should be taken. Sometimes abbreviations may also get in the way. We know that many medications have incredibly long, convoluted, or complicated names, and so on labels of bottles, for example, there may be abbreviations used, or physicians may use abbreviations when prescribing medications, and that may lead to some confusion as to which medications you should be taking based on not knowing what that abbreviation means. Finally, there's always the feeling that with all of these different factors in mind, an individual may feel overwhelmed. This is especially common if you're taking a large number of medications, or you're taking medications at an inconsistent schedule. For example, you take one medication one day and you take another medication once a week, for example. You take another medication every single day. That can lead to some confusion, and it can be hard to keep on track. And so it's important to come up with a plan that works for you personally in order to ensure that you are taking the right medications at the right time. As we've alluded to, the good news about medications is they are preventable. It's all just a matter of working amongst yourself, your family members, and with your healthcare providers to ensure that you stay on top of these the ways in which your medication is prescribed to ensure that you're taking it appropriately. One way that you can do this is to keep an updated medication list. And there are several benefits to this. First and foremost, keeping a medication list ensures that you have the most updated and accurate medications. Not doing so can lead to harmful diagnosis or potential prescribing of other medications which might have conflicting side effects. For example, if you don't stay up to date with your medication list, for example, the medication list that you currently have is from 2 years ago, and you show this to your physician, they may recognize that you're taking a medication perhaps that you aren't, or the medication list may not have all of the medications which have been prescribed over the past 2 years. And for that reason, they may prescribe a medication which you feel you maybe not be taking, or a medication which potentially may have some interactions. And of course, this can lead to some adverse side effects. Therefore, staying updated with a medication list that is up to today's date, whether that's keeping a physical copy, whether it's writing it down in your notes on your phone, whether it's taking a picture of them and having that somewhere on your phone or in your purse or your wallet, it's really important to ensure that you also date whenever you make this medication list so you know that this is the most updated list available to you. Another reason why it's so important is we don't know what other medications you may be taking outside of the clinic, for example, at Dr. Curnew's clinic. So that may lead to some confusion when a doctor is prescribing more medications. Again, this is so important as to why it is crucial to stay updated with your medication list so that whenever a physician is prescribing new medications, they can have a full understanding of all the medications you are and are not taking to ensure that they are prescribing medications which are appropriate to you based on the other medications you're having. Finally, it allows you to keep track of your own health. We recognize that in order to stay on top of medications, you need to have a good understanding of what they're doing in your bodies and how they are benefiting you. Having a good understanding of what your medications are doing for you, how they're working, can give you also an appreciation for what you can do in terms of other lifestyle interventions you can implement to help you reach your goals. For instance, if you're taking hypertensive medications to help manage your blood pressure, you may recognize that increasing the amount of activity you're getting on a weekly basis, whether it's implementing walks in your daily routine or just avoiding things like snacks that are overly rich in sodium or foods that are rich in carbohydrates, of course, that are all things that you can sort of implement in your lifestyle just based on knowing what medications you're taking alone. The more you understand about your medications, the better you can stay organized and the better chance you have at staying healthy. So it begs the question, what does a good medication list look like? As we mentioned, first and foremost, it's important to have the date of the medication list so that you understand when this medication list was made, so that you know whether it is a recent medication list or one that is slightly dated. On your medication list, it's important to have your name and emergency contact in the event that someone ever needs to be contacted, whether it's a physician who might need to contact a family member to acquire more information or things of that nature. Again, the list, the date of that the list was updated. And finally, information about the prescription medications themselves. This includes the name of the medication, how often you take it, what the medication is taken for, who prescribed the medication, the dosage, and any other additional notes which may be relevant for you to understand, or perhaps a healthcare provider might be relevant to understand. It's also a good idea if you know that you have any medication allergies or just any allergies in general to write these down in your medications list so that you can share it with your healthcare providers so they're aware whether or not medications with certain ingredients should be prescribed to you or whether we should avoid certain medications because you have a potential allergy to it. For instance, penicillin is a quite common allergy medication. Finally, just having information on your pharmacy who is prescribing your medications is really important. This is also really relevant so that your doctor knows who to fax these medications to so that you know and they know where you pick up the medications and they can always communicate with the pharmacist if they ever have to ask any questions or if the pharmacist needs to clarify further things with the prescribing physician. Dr. Curnew, did you want to add anything about the medications list?
Yeah, I think it's actually important with that you understand who's prescribing what. During the pandemic, it's been a difficult time, so many physicians have prescribed medications that they don't normally prescribe, which is great. But and, some family doctors want to be in charge of all medications. But I think it's wonderful if you have a family doctor who's your quarterback. Some other doctors feel that if I started a medication that I should always write that prescription for medication, that's fine too as well. So it's coordination. And you might want a blister pack, you may want a 30-day supply, but most people actually want a long prescription. So what I'd like to do as much as I can is when I see you, decide if we're on the right medications and then renew all your medications that are chronic medications. You're taking, let's say, 2 blood pressure pills, 2 cholesterol pills, 3 for diabetes. I'd like to actually give you a 100-day supply, but 3 repeats. So you have enough that'll take you well over a year. And I try to renew them all at the same time. So therefore you don't have to be fumbling around, and it's good for you. But and many pharmacists have their systems where they only renew one at a time, things of that nature. So you have to work together to figure this out. So wouldn't it be better if we can actually coordinate this better? I'm hoping the app will be a place that there's really no place in Ontario that I know in Canada where it has a really good source of all your medications. You are the source of your medications. We all make mistakes, and I make mistakes, you make mistakes, the pharmacy makes mistakes. There's many people involved in this. So you need to realize that you need to be involved in this. If you want to just let other people look after things, that's certainly one solution, but that probably is going to lead to medical errors. And let's figure out how to work this together better in some way. And an ideal world is that on Star Trek, you get beamed to the pharmacist, you get beamed with the farmer, everybody gets beamed to the same place, and we all have a discussion on the right track. But that doesn't happen. So you need to make sure that you understand what you're taking, why you're taking. Is it still the right medication for you? And the same thing too is that a lot of people are taking fish oils. Well, fish oil capsules have no protection for the heart. They increase incidence of atrial fibrillation. I don't know. I don't want to have atrial fibrillation. If you want to take a fish oil preparation that's a cardiovascular protection, it's pure EPA, and that's by prescription, for instance. Should I take aspirin or not? If I had heart disease, had a stroke or heart attack, the answer is you need to be on aspirin. If you never had a heart attack, you probably shouldn't be on aspirin. Should we adjust your blood pressure pills? Well, we're going to talk about whether or not how to adjust your blood pressure pills. That's based on your home blood pressure readings. Any thoughts from anybody else? Is that, if I look at most electronic medical records, most pharmacists, one of the biggest source of preventable medical errors is just that medications. So that's a weak part of the link because it's so many people are involved. So make sure you're involved. I'll be quiet for a little bit.
Absolutely. So as Dr. Curnew mentioned, being involved in your own health is so crucial. So again, getting back to the conversation of medication list and some of the features that makes it so good, Dr. Curnew mentioned, of course, having your provider or the person who prescribed the medications is really important on your medication list. That way, if you ever need to get in contact with a doctor and you have a question about a medication, you know who to call. And likewise, if you share this with a healthcare provider, they would also know who to connect with when it comes to the other doctors that are overseeing your care, if they have any questions about some of the medications you're taking. So again, some of the important things to remember in terms of your medication list is having the name of the medication. Of course, we know that medications can have different names. It can have the generic or brand name. So be aware of the different spellings or the similar names that may exist. Having an understanding of the dosage and the frequency, or how often you're taking these medications. And finally, the purpose for your medications, why you're taking them, what is it used for, and furthermore, if you have any additional instructions for how to take medications, whether it's with food or with fasting, or if you have any allergies to medications. These are all relevant things for you to remember, for any loved one who's overseeing your medications to remember, and that includes your healthcare providers as well. So one way that you can keep on track of your medications if you want to go the technology route is to use a application on the Apple device, which is known as Reminders. So if you go into your phone and you type in Reminders, or you just look for the app, which has these 3 rings, blue, red, and orange, it will open up a tab. This gives you the opportunity to input a reminder. As you can see, we just typed in testing here just to give you an example of what you can type in here. You could, for example, put the title of medication reminders. You can click a button which then says remind me on a particular day. Once you click that button, you'll see more information. This includes how often you want to be reminded of this medication that you're taking, whether you're taking it every day, every week, every 2 weeks, every month, or once a year. Then you can indicate how often you're taking that medication so that you can be reminded at a particular time how often you need to be reminded that you need to take this medication. This is just one way that you can do it. Again, there are many other ways as well. If technology is not your strong suit, or if it's much easier to just take a picture or write down notes of what you need to do and refer to it on a daily basis, this is also something that you can consider. And while we have no affiliation or funding or sponsorship with Shoppers, one feature that is quite interesting, which has been recently implemented by Shoppers, is that they offer a new thing called online refills, and this is done through a particular app. And we're going to tell you a little bit about how to create an account and how to sign up for this program. So one way to stay on top of your health is, of course, to keep on track on when you need refills for your medications. And so one way you can do this, if you're getting your medications from a pharmacist and Shoppers, is to follow these instructions. First and foremost, if you go onto your internet browser and go to the Shoppers Drug Mart website, that's mypharmacy.shoppersdrugmart.ca, which you see indicated on the slide here, it will then come to the web page, which gives you the opportunity to create an account. Very similar to how Sanya was discussing when it comes to setting up an email or setting up a Facebook account. You're just going to provide information pertaining to your email and password, as well as your name and date of birth, just so that you're able to create an account. Furthermore, you'll also need to provide your OHIP card, your Government of Ontario health card, just so that they're able to line up who this person is based on a government-issued piece of identification. Some of the benefits when it comes to online refills is, well, first and foremost, the auto refill feature. You're able to refill prescriptions automatically when you're out. You can set up notifications for when you're running out of medications and request a refill for medications, which goes directly to your pharmacy through this website and app. You can also share this information with other family members. You can basically link accounts with anyone who is overseeing your medications. That way they can also be notified of when you need refills and they can oversee the refill process. The third benefit is that it's fast and easy. Essentially everything is all in one place when it comes to requesting refills. You can do it entirely online. You're able to avoid the wait times when it comes to going into the pharmacy and requesting the refills yourself, which can then have them contact the physician and then connect with the pharmacist once again. And so this sort of jumpstarts that process. So how essentially do you do these auto refills? As I mentioned, you want to sign up with a provincial health card or health benefits card. Then you can then click a feature which allows you to set up auto refills. Then what you can do is set up a feature which allows you to get pickup notifications so that as soon as your prescription is ready to be picked up at your local pharmacy, you can choose whether you'd like to receive a notification via text or via email. And once you get this text or email, essentially the nice benefit is you're able to skip the wait. Your prescription will be waiting for you at the pickup counter when you go visit your pharmacist. You simply, of course, have to provide some sort of piece of identification to ensure that they're matching up the person's prescription with the actual person themselves. Now, as I mentioned as well, another benefit that this feature offers is, well, you can have other loved ones oversee your prescriptions. So when you sign up for an account, you can also add a family member through the online pharmacy services. After verifying your relevant information, they'll be able to view and manage the prescriptions on the dashboard just by switching accounts so that they can check out theirs, but they can also check out yours as well. The verification process, as they share on the website, is quite secure and straightforward. You personally would need the family member's health card, their drug benefits card, and a prescription medication package from that particular pharmacy. You can add one or multiple family members depending on how many people you need to oversee your care or how many people you are overseeing when it comes to managing others' prescriptions. And finally, you'll need to verify their prescription information and that they maybe need verbal consent to ensure that they provide consent to you overseeing their care. You don't have to be a directly related family member as well in order to be added to their account. That's another feature which they share on their website. So if it's just a loved one but it's not part of your direct family, there's still an option for you to oversee their care through this particular website feature. Finally, then you can enjoy many of the features that comes with being a subscriber to Shoppers, which includes information about various newsletters. You can view the patient's full prescription history, and of course, you can set up that automatic refill feature as we discussed earlier. So this brings us to our next section, and a very relevant one as well when it comes to keeping on track of your health, and that's tracking your blood pressure. So Dr. Curnew recommends that you invest in your health and that everyone has a blood pressure machine. And today we want to briefly discuss, well, what is blood pressure? How do you appropriately measure it? And how do you manage your blood pressure well? So we've all heard the word blood pressure. We understand the numbers, and maybe some of us might understand what's a good range to be in. But it's important to also understand the relevance that being in this good reference range has to your overall health. If you ever have any issues with blood pressure, as we mentioned, it is important to invest in your own health by buying a blood pressure machine. It's important to check your blood pressure quite frequently. At the clinic, Dr. Curnew will recommend taking your blood pressure 3 times a week. As when you go to a doctor's office, it's not the most reliable reading if you only rely on that blood pressure measurement. The reason why is because there's a phenomenon known as the white coat effect, where individuals may not realize that their blood pressure is elevated, but just the fact that they are in a high stress setting, such as a doctor's clinic, it can cause their blood pressure to spike unknowingly, and therefore that's not the best indicator for an individual, be it a cardiologist or any other healthcare provider, to use when it comes to prescribing medications, for example, or offering support, treatment, or resources. And so how do you measure your blood pressure from home? Well, as we mentioned, taking 3 readings a week is really important, but also making sure that at each setting, you're taking 3 readings in a row. The way that we often describe it is you want to take 3 readings. The first one, you kind of just want to treat as a calibration measurement and not one that you'll actually use towards calculating your blood pressure. What you then want to do after taking your first blood pressure reading and discarding that value is taking it 2 more times. And with those 2 other measurements, you want to take the average of both of them. So as you can see right here, we have a picture of 3 readings. You see that we discard the first one, which has a systolic of 146, but then we take the 2 readings after that, which had a 133 and a 131 systolic measurement. Then basically you can see that the average checks out to about a 132 systolic. If we did the same for diastolic and heart rate, you'll see the average is there. And that's how you know that you've measured a reading which is accurate and appropriate for a doctor to use. Furthermore, as we mentioned, blood pressure does fluctuate quite regularly, and so it's important to look at blood pressure over a long duration or a long period of time and not just rely on a few measurements to know exactly where your reference range is. Some other suggestions when it comes to taking your blood pressure to ensure you're getting a reading which is most accurate is first and foremost to try and relax and rest. That includes trying to be seated quietly for at least 5 minutes before doing the measurement, ensuring that you're not consuming coffee 30 minutes prior to taking your blood pressure reading. Furthermore, it's also important to recognize that smoking also does increase blood pressure, and so not smoking 30 minutes prior to a reading is also crucial to ensure you're getting an accurate measurement. When you are taking your reading, you want to ensure that you're sitting in a chair with your feet flat on the ground, arms supported with elbows at heart level, and you don't want to talk during your measurements because just talking, the action of talking, can cause your blood pressure to fluctuate. And so with all these in mind, you essentially want to be in a state of meditation, a state of relaxation when you're taking your blood pressure readings, and again, taking the average of the last 2 readings you take. Another thing that is relevant to blood itself, not necessarily blood pressure, but blood work, is how to access your lab results online. Whenever we have a patient coming into Dr. Curnew's clinic, we often will share them or provide with them a blood requisition form so that they can head over to their local lab center, whether it's Life Labs, DynaCare, or any others, to get their blood pressure, to get their blood work measured. And so you'll see right here that there is an option to find your blood work online just by going to lifelabs.com if you are doing it through Life Labs. There's also a tab which you'll see on the website which says See My Results. There, once you click it and provide in your personal information, you may also have to create an account. You'll be able to look at your lab results from the recent blood measurements in which you have taken. Now, we have created 2 wonderful videos in the past led by Sanya and her team, which shows you how to access measurements, whether it be through Life Labs or through DynaCare. So if you've taken a recent blood work or you anticipate taking blood work in the future and you'd like to have a copy of your blood work accessible to you, what you can do is you can check out these resources which we've created. We've also provided them in the description of our YouTube video. And there you'll be able to get a step-by-step breakdown on how to create an account and how to access your blood work online.
This, I think, go back one more. This is really important. I think everybody should learn how to do this. And yes, I get stuck along the way. Again, ask a young person, ask Life Labs, ask DynaCare, get your results. People make the assumption if no news is good news. no news is no news. And really is that, so we spend a lot of time trying to go over results from tests and blood work. And we get a lot of information. I like to do that when I'm with you before your appointment. So if you want to, when we get an encounter, ask me, what's my blood work? What's my stress test? What's my Holter monitor? Just ask those questions so we make sure that we review that. At the same time, I'm saying is that you prescribe these 3 medications, Dr. Curnew. I have 1 prescription renewals. Is that still enough? And make sure I give enough medications to last you for to at least your next appointment, and maybe for a year for chronic medication. So you can see how the internet and how we can actually work so much better together. And none of us are perfect. And what I learned from my training in cardiac arrest is that, please give this patient 1 milligram of epinephrine. And the person who gives an epinephrine, I just gave 1 milligram of epinephrine. So we actually close that loop. So I ordered a Holter monitor on you, and you say, Dr. Kern, you did the Holter monitor on me. What were those results? And then we close that loop. Don't, let's not make any mistakes. We're all make mistakes. We're all human. And right now, because of this mad rush in the world, and because of COVID and things get fall through the cracks. Let's not that happen. And one of the biggest thing and I hate to say this, is medication errors are such a preventable, or not preventable, that you can decrease the amount of them. We're all making medications. Dr. Smith's changed this, your pharmacist told you this, your next door neighbor this, and you're not sure what to do. Call, let's talk about it. So if I prescribe the medication to you, I'm glad for you to book an appointment to talk about. Just make sure it's still the right choice for you. Okay, they may come up with some really great suggestions, but just don't let things go by chance. Yes, it makes more encounters, but it makes the right encounters. And I always think of doctors doing 3 things. Doctors, make the diagnosis, give your symptoms, and we spend most of the time making the diagnosis and dealing with in crisis mode. And that's probably about 80% of what physicians do. But some doctors spend more time in prevention. And I like to actually, I spend a lot more time in prevention. I like to actually prevent you from having that heart attack, that stroke. And we'll spend a more better time in that area. And the third phase is end of life. The last 2 to 3 years of most of our lives will be spent in illness, and it won't always be so pleasant. So I take great pride in how to make the last time you have left as best as possible. But the thing that I really want to spend the most with you is how to keep you going for as long as you can, how to work on prevention. And that's, to me, such an important concept. And that's why we do this. Yes, I want to make the right diagnosis. And today I'm really proud of our team. I was just talking with Sonia, Stephanie, and Stuart, and all our students here today, is that I'm 2 hours behind today because someone walked into the clinic who was short of breath, and we did an ultrasound test, and they had this tumor in the heart called probably an atrial myxoma. Atrial myxoma is a benign tumor, but it's very friable. It can break off and have a stroke. And so basically, I was able to contact the emergency room. I was able to contact the cardiovascular surgeon. This person's in the hospital today, is going to go for surgery tomorrow. That's a big deal. And we can prevent that stroke. And it takes a whole team of people to make that work, from the echo, from the family doctor to send that person into getting in contact with the right people. That takes time. And that's what I want to spend my time doing when it's most important. I have 15 prescription renewals to deal with. That's taking people a lot of time. That shouldn't happen very often. Those are things that take away from the care of important information. Your prescription renewals are very important, but we have to make sure they're right. So let's make that proper contact at the right place, right time. The same thing with blood work. We can do it so much better. And I'm hopeful that Stephanie and her team will really put together a really fantastic app that will give you good information that makes you want to go back. And, I hate to say this, but I spoke to Shoppers Drug Mart. Let's actually share resources. They don't want to do that. Every company wants to work with their own system. I want to break down the barriers. I want to work with everybody. I want to have one place that is a central place for medication. I don't care if it's mine or yours. I just want to have one place that we all feel comfortable. That you as a patient, you as a family member, you as a pharmacist, you as the next door neighbor can all work together to have that information available, and that you're the quarterback of all this. So that's my goal with the app and all these sorts of things. And that we work together so you can be as healthy for as long as you can. So I can't, I won't, I'll do it later. You should know those are all errors waiting to happen. So the answer is let's work better and share ideas and give ideas.
And speaking of working better and sharing ideas, we wanted to once again highlight many of the online support resources that have been implemented at Dr. Curnew's clinic, particularly throughout the pandemic, all of which are accessible to anyone who is interested in joining and is interested in investing and working on their own health and working on their own health goals. So we're very briefly just going to go through all of the different clubs and initiatives that we have offered, when they take place, and then finally conclude with how you're able to contact us if you're interested in joining any of these. First and foremost, we have a weight loss club, which Sanya was discussing earlier. As we understand, working towards your individual health goals, managing your weight, and getting to a range that you're comfortable and satisfied with often takes a team. And so our health goal and our weight loss club is essentially focused on providing patients and individuals with tips on healthy eating, fitness, motivation, in terms of helping us all reach a common goal, and that's reaching our goal weight. So as a member of this team, you'll be able to either work with Dr. Curnew and his team individually or in a group of people if that's where you work best. These initiatives take place whether it be on Tuesdays from 4 to 7 if you're seeking individual support, as well as Saturday mornings from 10 to 12. And furthermore, we have a group session on a weekly basis, Tuesday evenings, which start at 7, can go beyond 8 o'clock, but we typically say the reference range is 1 hour, and we see what happens from there. If you're interested in joining us, again, we'll provide details on how to sign up. Another one that we have, which is a really great group led by a phenomenal team, is our Triple M's Club. It stands for Mindfulness, Meditation, and Movement. We understand that at Dr. Curnew's clinic, and when it comes to reaching your health goals, it's often important to take a holistic approach. This includes not just exercise, not just diet, but also focusing on your mindset, your mentality, your motivation, how you approach and deal with stress and conflict. So with this group, we're really focused on trying to provide a new way of approaching challenges, finding out different exercises that work for you, sharing a few jokes, having some laughs with other people, and de-stressing every Wednesday night, taking place from 7 o'clock. We also have our Losing 30 Pounds in 30 Weeks. This is a project which works concurrently with our Sugar Club, which focuses on those managing and trying to put their diabetes into remission. But here, club members will strive to lose 30 pounds in 30 weeks or less. And the way this is done is by patients cycling through all of the clubs in which I'm discussing today, starting with a few weeks in the Weight Loss Club, a few weeks in the Triple M's Club, a few weeks in our Cooking Club, and it's taking a little bits of information that they can learn from each of them and try to implement it and apply it into their own life to build healthy lifestyle habits. These meetings take place the first Saturday of every month, beginning at 9 o'clock and typically going towards 11 o'clock. We also have our Smoking Cessation and Breathing Better Club for anyone who's interested and focused on cutting back or quitting when it comes to smoking. If you're currently smoking and have ever thought about quitting, have tried multiple times, have found yourself having some success or having no success, whether it be whatever you are when it comes to this journey, let us know and we'd be more than happy to help with you in this journey. Typically for these, calls take place on Tuesday afternoons. These are often done individually on a one-on-one basis, and the team basically works with you at a schedule that works best for you to help you quit smoking, discussing and coming up with a quitting plan, and keeping you accountable in ways that work best for you individually. Furthermore, we also have a club led by Aditi. This happens every second Sunday of the month, typically in the afternoons, about 4 to 6. This is called Sunday Dinners. Essentially what happens is our staff and our team will work towards sharing some recipes, ideas on a particular culture and a particular tradition. There's typically some sort of general theme when it comes to the food that we're cooking on that particular day. Here you can learn about different recipes, learn a lot about topics and ideas related to nutrition, And here we just share ideas. We go back and forth on what we think is good, what we think isn't. Diet is an interesting science because there's many opinions, and it's fun to listen to other people's opinions and share our own opinions when it comes to what has worked for us and what hasn't worked for us, whether it comes to how we feel, how we look, etc., etc. During these sessions, of course, we discuss other topics as well, such as the importance of micronutrients, anti-inflammatory ingredients in your cooking, and optimizing your meals based on Canadian food guides, based on other guidelines, with each session including several recipe ideas, which you can try to put into practice after the call.
Well, actually, this week it's going to be kind of interesting. If anybody wants to join us, we changed it to we're doing it on how to get calcium in your food. So people should take a calcium pill or not. I'd rather say is how to get calcium naturally from your food, and it's a much better way of absorbing, and it does healthy things. So we're actually joining us. If you want to join us, be between 4 o'clock and 6 o'clock this Sunday. Fantastic. Dee Dee's really put together some remarkable webinars, and we have other speakers like Dr. Ganguly joins us, who's a very much plant-based eater. If you really want to get good information about plant-based eating, join the UK vegetarian group. They're fantastic. But there's other things too as well. You can see this is salmon, and so eating well is actually important, and just fish into your diet is a Mediterranean diet, and just how to cook and eat better is fantastic. So take a look at some of these things. It's remarkable. What I will say is that success is for most of us is hard work. You know what? I've been working hard for 50 years. I'm still grateful to be able to contribute and keep learning, and come join us, come work with us, and come share your ideas as well. I think 20% of health is luck. I think 60% is hard work, and 20% I'm not quite sure what it is some days, but those are the things that you can make a difference, and enjoy making a difference, and don't be hard on yourself. Just get better and improve, and we're all getting better, and get young people around you to make you better. And that's I've been very lucky. My health is improved, and my understanding is improved because of all these young people. I'm very grateful to. I'm also very grateful for my office staff, all the people working here, for all the patients too as well who put in their hard work. And so thank you for letting me make hopefully a small difference in your lives.
So very well said, Dr. Curnew. Just a final shout out, if you want to learn more information on the various focus groups or other health resources available to you at our clinic, you're more than welcome to check out the webinar, which we've recently launched. The best way to find it is just to go into your browser and type in www.drcurnewhealth.com, and it'll take you straight to the main page where you'll get to see all of the features which we discussed earlier in today's webinar when Stephanie so kindly showed us every single page currently available. Finally, again, as I've mentioned, there is the feature on the website where you can learn more about the clinic, our goals, and also the focus groups we have. We've once again listed the website here, so once you're more than welcome to come back to this webinar at any time if you ever need the link. And if you ever want to sign up for these, you're more than welcome to just click the button on the website which says sign up. There you'll just be able to provide your information as to how to reach you, whether it's your phone number, your email, just so that we know how to get in touch with you, how to get you organized and into these programs as soon as possible, so that you can start working with us and working towards the goals that you're striving to achieve. And a final way to also reach us, if it's much easier for you, is also just to send us a simple email. You can reach us at drcurnew232@gmail.com, and there you can provide any information as to which groups you'd like to sign up for, what you'd like to see on future webinars, or any ideas you have towards the website which we've recently launched, because ultimately it is for those who are hoping to continue to engage with their health and reach their individual health goals. So if we can curate the website or all of the things that we offer based on what you're looking for, then that is ultimately our goal, and we're always going to strive towards achieving that goal. So thank you very much for those who joined us. We appreciate you taking some time to learn more about how to harness the power of technology to help you reach your health goals. We hope you learned a few things, and as always, if you ever have any questions, you're more than welcome to ask us at your next appointment by sending us an email or by rewatching this video. And as Dr. Curnew said, you remember about 20% of what you learn, 15% for for some of us, probably me. So taking time to rewind, rewatch, and take it at your own pace is really important, as a lot of information was shared today. So it's truly impossible to remember all of it, but if you remember some of it and rewind in the future, then you'll be able to take all of the important information that's relevant to you. So Dr. Curnew, I'll pass it back to you. Did you have any questions, thoughts, ideas, anything you wanted to share?
I just think is for you to be healthy, you need a whole healthcare team. I look at most professional athletes, they have an entourage. Get yourself an entourage. That can start off with your spouse, friends, neighbors, but surround yourself with people that want to be healthy, that you can make healthier, and you can feel comfortable working in that area. And it's hard work, and some things work and some things don't. We can say that our other website is blown up. It didn't work. We learned a lot from that, and this one I think will be a big improvement. I look at all the different things we've done, and I'm very grateful to serve. I still feel that I have something to contribute, and please work with people and work hard on this. I really want to thank all the people here that who put hours and hours of hard work. You need to put hours and hours of hard work for your health and learn new things. I'm going to let Stephanie and Sonia say some last thoughts about this, and how do you keep yourself healthier, and what are some of the points that you want to make, and thank you so much for all you've done. I'll start off with Sonia.
Yeah, thanks, Dr. Curnew. I think both you and Stuart summed it up pretty well. We obviously talked a lot about today, a lot of information here, but please do take the time to check out the website, check out the videos we're making, the resources. We're really here to support you in any way that you can, and we hope that giving you bite-sized information, and hopefully you're learning also how to use technology to maximize your health. So yeah, just that, reach out if you ever need any more support. If you have any questions, we know it can be challenging and hard at times to navigate all of these different platforms and apps, but we're here to help. So please do reach out.
Stephanie.
Yeah, so honestly, Sonia kind of said it all. I guess keep an eye out for the website, keep an eye out for updates to the website, updates to the app, all that good stuff. How to stay healthy. I mean, stay connected with your resources. Keep trying to stay interested and keep taking knowledge. Great way to do that is through our website and app. So yeah, that's about it.
Be curious, keep learning, and learn from reputable sources. Were there any questions out there at all, Stuart, at all? Or anything else any comments that you want to bring into this?
Just an idea for a future webinar is to just share how to operate some of the apps on the iPhone, whether it's FaceTime, for example, and just how to stay connected with family members virtually was something that was suggested. So that is something that we'll take into consideration for a future webinar, and something that we will certainly hope to implement. Certainly a good idea for a future video as well. There wasn't particularly any other questions or comments other than that. So I suppose we can sign off whenever we're ready. But before we do that, I guess I just wanted to thank everyone for putting together such a phenomenal webinar. That includes all of the hardworking contributions from Sanya and Stephanie over the past several weeks, months, and years. All the hard work that they put in the past and will certainly be putting into the future as well. And I guess I just also wanted to thank Dr. Curnew, his wonderful staff, his wonderful team, and also all of the patients who have stopped by, whether it was one webinar for 5 minutes, or those who have consistently showed up almost every single week to listen, learn, take some notes, and enjoy just staying connected with other people. It's been a true honor and privilege to be able to host these webinars for the past 2 years. This is the last one for me, as I'll be transitioning out of the role and passing it over to a good friend of mine, Daniel, who will be starting to lead these webinars. So it's truly been a pleasure hosting over 100 of them alongside a phenomenal team of colleagues, a phenomenal doctor, and wonderful patients who are so sincere, kind, and not only focused on themselves and reaching their goals, but also supportive towards others. I feel like I've realized that the world is a great place with wonderful people, and especially throughout the pandemic, it's been wonderful staying connected with so many wonderful, wonderful people. So thank you everyone for making this experience memorable and rewarding for myself.
And a special thanks goes to Stuart. He's put hours of work. He's going to be starting medical school this fall, and Sonia's already in medical school. Stephanie's going to take over the world. And I know that Sedinger is there. He comes to most of these webinars and things, and he actually joined in from India one time too as well. So I'm very grateful, and let's get healthier and let's make the world healthier, because the world has not been a kind place for many of us right now. So let's make the world a little kinder and better. And if we all do our little bit, that would be great. So thank you all so much, and have a great night. And thank you all for all your efforts. It's well appreciated. Thank you.